Legacy Hospice. Compassion at the end of life. Our standard of care for our patients must always be at the level we would give to our own family. Visit us today at legacyhospicecares.com.
Hello, and welcome to the third and final part of a three-part educational series being provided by Legacy Hospice to discuss features of our complementary therapy program with facilities, families, and patients. My name is Lynne Hiatt, and I'm the Director of Complementary Therapy at Legacy Hospice. I'm also a hospice and holistic nurse and hold certifications in a number of holistic modalities. Today's discussion will include specific information about the following: acupressure, craniosacral therapy, massage therapy, and mind-body techniques, including breathwork, guided imagery, and meditation. The first topic I'll be discussing is acupressure. Acupressure is an ancient healing art that uses fingers to press key points on the surface of the skin to stimulate the body's own natural healing abilities. When these points are pressed, they release muscular tension and promote the circulation of blood and the body's own life force to aid healing. Acupressure and acupuncture use the same points. However, acupressure uses fingers or hand manipulation, and acupuncture uses needles. Acupressure continues to be a very effective method of treating stress. It is the most effective method of self-treatment for stress using the power and sensitivity of the human hand. Acupressure has been proven to be effective for hundreds of years in helping to relieve pain, many stress-related conditions, sinus problems, gastrointestinal problems, and issues with sleep. It is particularly helpful in treating anxiety. The healing benefits of acupressure involve both relaxation of the physical body and also the effects on the mind. When your body relaxes, your mind relaxes as well, helping to create mental clarity and increased physical and emotional healing. Our next topic is craniosacral therapy. Craniosacral therapy is also a gentle, hands-on therapy that releases tensions deep within the body to relieve pain, dysfunction, and to improve whole body health and performance. Using a very soft touch, which is usually no more than 5 grams, which is the weight of a nickel, practitioners release restrictions in the soft tissues that surround the central nervous system. So how does craniosacral therapy work? There are a few structures that have as much influence on our body's ability to function properly as the brain and spinal cord, which make up the central nervous system. And the central nervous system is heavily influenced by the craniosacral system, the membranes and fluids that surround, protect, and nourish the brain and spinal cord. Day-to-day stresses can cause tensions within the body. These tensions may cause restrictions which can affect the entire body. These restrictions can be detected and corrected with simple methods of touch by a skilled craniosacral therapy practitioner. Craniosacral therapy also frequently induces a very deep state of relaxation, during which healing from stress and anxiety can occur. Some of the conditions that craniosacral therapy may address include traumatic brain injuries. For us, that would be someone perhaps who's had a stroke or brain surgery, chronic neck and back pain, stress and tension related disorders, chronic pain, chronic fatigue, and other central nervous system disorders such as Parkinson's disease. Craniosacral therapy enhances the body's own abilities and regulates the central nervous system. It works with your body to gently release physical restrictions, and in so doing, helps to release trapped stress and emotions which may be caught up in our bodies. The next thing we're going to discuss is massage. The sense of touch is a powerful and highly sensitive form of communication. It is a natural human reaction to reach out and touch, to respond to another person, or to provide comfort by touch. The Chinese were among the first to recognize the value of massage as early as 3000 BC. Roman and Greek philosophers and physicians frequently prescribed massage for its restorative power, as well as what they considered to be preservation of the body and the mind. Most people love massage. Babies, elders, sportsmen, athletes of all kinds. Any individual at any age can benefit from this powerful form of communication. Massage is a very effective aid to provide relaxation, soothing away stress, relieving tensions in the body, and facilitating sleep. Massage helps to improve function of many of the body's systems and promotes healing of body, mind, and spirit. There are many types of massage, but what we use most commonly with our hospice population is a type of massage that was developed by a physician who was also an aromatherapist and studied and did a number of long-term studies with people in the long-term care population and hospice population. She found that her technique, called the M technique, was very successful in decreasing anxiety and providing a comforting touch. The next thing we'll be discussing are mind-body medicine techniques, the first of which is breath work. When individuals are under stress, they tend to breathe more shallowly, faster, and possibly irregularly. Deep or controlled breathing can counteract the physiologic stress response, as respiration is the only autonomic body function which is both voluntary and involuntary. Stress activates the sympathetic nervous system and respirations then increase. By taking control of one's breathing and voluntarily slowing it down, an individual can then activate the parasympathetic nervous system and the relaxation response. To practice deep breathing and breath awareness, begin with a deep sigh. Then see how slow, deep, regular, and quiet you can make your breathing. Practice this for about 8 breaths and then see how you feel. Practicing breath awareness is something that can very easily be done with your patients, even while providing cares to them. You can start by just asking them to breathe with you and to breathe together. Guided imagery is another mind body technique, and it's something that's also been very effective with many populations. Our minds and bodies are connected and are one concept. As a result, the body cannot distinguish between things that are real and things that are imagined, just as fear. Visualization uses the imagination to create mental images of things. You can use visualization, much like daydreaming, to achieve many beneficial effects. When you visualize something happy, it's been proven that the brain releases endorphins, and you can use visualization to imagine a relaxing or peaceful situation. The more in detail and clear the imagery, the more beneficial it is. The key is to involve as many of the senses as possible and to make the imagery as real as possible. Guided imagery involves a facilitator guiding a participant in mental imagery that engages all of the senses. Over 200 studies offer compelling evidence that guided imagery can help to decrease pain, decrease stress, improve sleep, boost self-confidence, and also strengthen the immune system. Imagery has been shown to decrease heart rate, respiratory rate, increase oxygen levels, and increase neurotransmitter levels. The overall effect of imagery is improved health and a sense of well-being. The last of these techniques that we'll be discussing is meditation, which is a well-known form of mind-body medicine. The word meditation actually comes from the same Greek and Latin roots as the word medicine. There are thousands of meditation practices throughout the world with a wide range of goals. Ours is for relaxation. Meditation has been practiced around the world for greater than 5,000 years. Individuals report that they meditate for a variety of reasons, including health promotion, wellness, stress reduction, healing, and spirituality. So how does meditation work? Practicing meditation has been shown to induce certain changes in the body. Some types of meditation are felt to stimulate the parasympathetic nervous system, which, as you recall, will help the body to decrease heart rate, blood pressure, and respiratory rate. Meditation also helps muscles relax and muscular tension to decrease. Meditating for as little as 10 minutes per day has been found to have profound health effects. So when we think of meditation, many of us think about what we used to think about, a person sitting in the lotus position, chanting, and that is indeed a type of meditation practice. However, there's a well-known type of meditation called mindfulness meditation, which is actually easy to do in any type of body position, and is simply the following. Mindfulness meditation has been described as the art of becoming deeply aware of the present moment as an impartial observer, simply sitting quietly and observing. So this is something that we can actually do with our patients as well, especially in the months where we can take them outside. We could sit with them and listen to the wind, watch the clouds, listen to the birds. It requires one to not have conversation, but to simply observe your environment and focus on what's around you. So this concludes our presentation on holistic modalities. As you have heard, all of these methods are non-invasive, do not employ the use of any pharmacologic agents, and are very nurturing and gentle techniques. Throughout the period of time during which I have been using these techniques with our hospice patients, I have observed that most patients have a deep response with deep relaxation, a decrease, sometimes dramatic, in pain, decreased shortness of breath, and improved cognition, such as increased ability to engage with others, sometimes an increase in the ability to verbalize their thoughts, and increased alertness. All of these modalities can also be done all through end of life up until the time the patient actually transitions. This provides a great deal of comfort through the actual practice of these modalities and the fact that there is further hands-on nurturing touch. It is with great pleasure that we at Legacy Hospice offer these complementary medicine techniques to our patients as part of our Legacy Hospice program and mission and philosophy to care for our hospice patients as though they are our own family. Thank you.